You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, no more bleeding gums, no more bad breath, and no more gum disease. We're talking about laser dentistry today, how to avoid the traditional surgery, and the doctor literally goes around the mouth with a laser, kills the bad bugs, you get clean, healthy looking and feeling teeth. With us, we have an expert on this topic, Dr. Saeid Badie. Dr. Badie, welcome to the program.
Thank you, Randy, for having me here.
Good. Now, I know you brought some photos, so
Yes.
we'll get to as many of those as possible. Now, for people that don't know your practice, like who's the typical patient that comes in for this laser or for gum disease treatment?
Yeah, the typical patients usually come in with bleeding gums or they're in pain. Usually they have a bad breath. Maybe their wife or significant other says, you know, it's time to go see a dentist. Men don't want to go see a dentist. So it's usually when somebody tells them that they realize that it's a problem and they want to come see us. Well, the second group of patients are the patients who come to our practice because they've been told that they need traditional surgery, which is usually accompanied by some pain, and it's not fun. Okay. So they come and see us for that.
So for a working definition today, like what defines gum disease? Like what is it?
Basically,
and how do you know you have it?
It's inflammation.
Okay.
The first sign of gum disease is inflammation, or some people know as bleeding gums or gingivitis.
Okay.
So we got to treat that right from the get-go before it becomes manifest to something bigger. So we want to be able to, that's what gum gets. The first sign of bleeding gums is gum disease.
So it's a bacterial infection?
Yes. It's always a bacterial infection, most of the time. There's sometimes some other reasons for maybe a virus can cause that too, problem with the gum. But mostly it's the bacterial infection that causes the gum problem and the bone problem. So what we can do with this laser that we have, it actually kills and zaps those bacteria deep down into the pocket and kills it.
Okay. Now, tell me how, because you say this is like a very popular procedure to get this, it keeps periodontists across Arizona, across the country very busy. So there's two ways to get rid of this bacterial infection, the gum disease.
Yes.
So what's typically done and how are you doing it?
Well, typically you have to actually cut and pull the gum up. Or the gum disease is the bacteria underneath the gum. In order to access, traditionally, in order to access and take care of the disease, you have to open the gum and get access deep down into the pockets.
So like kind of peeling back the gums?
Yes, and you have to peel it back, but you have to cut, and there's bleeding involved with that too. But traditionally, they have to remove the gum. I mean, they have to open the gum.
Okay.
And they have to remove the infected tissue, cut it, and size it, and do a scale and root planing. Then they have to sew the gum back up. With stitches. You got to have stitches.
All right.
And that involves some pain afterward, post-operative pain. But the way we do it, we actually use a laser. The laser actually goes around the gum, around the bone, the teeth, and kills those bacteria. So we treat it as a bacterial infection. You can't cut a bacterial infection, but we use the laser. That energy from the laser kills the bacteria.
Okay, so and we've talked on the phone about this, and I'm trying to really wrap my mind around how this works. So the way they treat the bleeding gums, the bad breath, the loose teeth, is they're kind of cutting it out.
Yes.
Right?
Yes.
And you say it's, I don't want to put words in your mouth, like kind of absurd or barbaric, that if you treat it like a bacteria, so the laser kills the bacteria.
Yes.
And then what happens?
And the gum has a chance to heal. There's bone coming back, the gum has a chance to heal around the teeth, and it helps quite a bit. So what happens, the gum grabs onto the tooth and the bone, and the bone is stimulated, and the bacteria are dead. Okay. 95% of them. And the gum, the area, your body has a chance to heal now. Okay. And take care of your gum and bone.
So, anticipating this interview, there's like 30 million plus people wearing an upper lower denture.
Correct, yes.
Would you say most of those people had gum disease, that's why they lost their tooth?
Yes,
teeth?
And what happened? They waited. Decades they waited. And now it's too late. Now they have to get the teeth out and get dentures. But what we want to do is get the patients in so we can give an option, which is not about cutting and stitching.
Okay, is this like the holistic crowd that is drawn toward this type of laser dentistry, like the Whole Foods crowd? Like they don't want the antibiotics, they don't want this, like the laser kills the bacteria in their mouth?
Well, it could be, but not necessarily. It's about healing the area. We want to get rid of the bacteria so your body has a chance to heal itself. Naturally, normally the body needs to heal itself. You get rid of the cause and the problem, and the body can heal. you get rid of the bacteria, the body want to heal. It's the same thing, you know. You get a cut on your finger and you keep it clean and the body heals automatically. So that's what body does. Well, I have a patient who came in, her name is Anna, and she was really down and out on her teeth. Her husband said, you got to yank all your teeth and get rid of them. They're not good enough. And she was really depressed. So she came to me and her teeth were so splayed and they were mobile. And I used...
Like the teeth are moving?
Yes, they were moving. They were flared out.
Why? Why do teeth get loose? Is there an easy way to explain this?
Because you lose bone around it and the bad bite.
From the bacterial infection?
Yes, that's first. And then your teeth don't come together very nicely. So the lower teeth, the jaw moves, the lower one pushes the upper one, and there's not enough bone around it, so they tend to be splayed out.
Okay.
But what we did for Anna was amazing. I used the laser and went around the gum and bone, and then she came back a couple of weeks later, no pain, and the tooth was actually tight. So what we did, we used the laser, we went around it. You see this bacteria, they're moving around. We zapped those bacteria, and when you look at it a couple of weeks later, there's less number of bacteria in there under the slide.
Okay.
And you just use that energy, the energy of the laser is the amazing thing. It kills those bacteria.
Now you say the bacteria has color to it, and the laser picks up the color.
Yes, it's pigmented, it has color. So those bacteria that have color in there love that energy of the laser. They grab it, and then they die, they go away.
Now, we have a little bit of a video clip of a kind of a before and after of the bad bugs in somebody's mouth. And what are we looking at here?
Well, what we're looking at it is a lot of bacteria. These are little creatures moving around. But what we do is we're using the laser energy to reduce the number of bacteria that cause the problem. So we actually killing this bacteria.
So you swab the mouth.
Yes.
Put it in there.
Put it under.
When I see all these bugs or whatever they are, so those are like bad bugs.
Yes.
In the mouth.
The
Those
bad
are what
bugs
make you lose your teeth.
Those are your enemy.
Okay.
Those
now,
are the ones that cause bad bugs.
In the second one I'm looking at, it's kind of like they're just floating. They're dead.
They're floating. They're dead. Those are the dead bacteria. They're dead.
Now, I've told you, I've had periodontists. These are the gum people. These are the people that treat gum disease.
Yes.
I've had them on the show, and they said, we would never do this pocket reduction surgery ever again, where they're cutting open the gums, stitching them back up, and then every 3 months, it's this vicious cycle of deep cleaning after deep cleaning. They say they only use the laser now.
Right. Yeah. Laser is amazing.
So this is like the newest trend.
It's new.
In dentistry.
It's not it's progressive. That's what we call progressive in dentistry.
Okay.
It helps to improve your smile. You got to keep your teeth, be able to chew, enjoy that apple, instead of going and get dentures. Now you can actually chop on those, enjoy your apple and corn on the cob. You don't have to get dentures. I'm actually saving your teeth.
So people that were told, like, we have to extract all your teeth, you need dentures or dental implants, because it could be expensive. You say that if you could get them early enough, kill the bacterial infection, they won't need to lose their teeth.
That's the key. We need to get these patients. I love to get them in so I can give them the options and hang on to their teeth for a much longer period of time, rather than be down on their luck. They think there's no hope, or I have to get surgery, or it's painful. And they wait years after years or decades. Now they're not coming back. But everything steps with the first step.
Okay.
You got the journey of 1,000 miles stops with the first step. That's the hardest one. Taking the first step is the hardest one.
Because nobody likes going to the dentist.
Nobody likes to go to a dentist. But I love dentistry. I want to just take that first step. And
so when should you make that call? Like, starts with bleeding gums?
If you see a bleeding gum, that's the first sign of problem.
But if you're flossing, isn't it it's normal to have a little bit of blood?
No, it's not, Randy.
Okay.
The thing is, it's not any less important than having a cut on your finger. What would happen if you have a cut on your finger? You attend to it. You put a Band-Aid. If it's bleeding a lot, you go see a doctor.
Okay.
The first sign, you got to attend to it, which means floss and come see me,
So
or your dentist.
So if you're bleeding when you floss, you have a bacterial infection. Chances are.
It's the starting of, yes.
Okay.
Bleeding, it's a sign of inflammation, like diabetes. Diabetes is an inflammation.
Okay.
Periodontitis, or gum disease, is an inflammation. They're correlated. We want to reduce diabetes because by attending to your gum and bone, by the laser. It's really life-changing. We can save your teeth. So when you have bleeding or a cut on your arm, forearm, what happens? It's a portal, it's an opening, it's a door, it's a gateway to invite all those little bacteria right into your bloodstreams.
Okay.
It's not any different than having bleeding gums. All the germs and bacteria, the healthy bacteria and the bad bacteria, we have healthy bacteria and the bad bacteria.
Your body.
They're leaking through your gums. And what happens to that blood? It's connected to your heart. That bacteria in your mouth goes through your heart, circulates, goes all the way to your toes, comes all the way back to your mouth.
So when I see things like on the website, like a button that says no cut, no sew in regard to this gum treatment with a laser, what does that mean?
Well, traditionally, we have to open the gum up. And we have to
like
cut
cutting it open.
Cut it open.
Okay.
But this way, we don't have to cut it open. And there's no stitches when you go home after the work. So we use the laser energy to get in and clean it up.
Okay, so you brought a video.
Yes.
And it's showing, it's an animation, I guess, of the actual laser procedure. So what are we looking at?
Randy, I really like this animation here. If you look at the animation, there's a laser fiber that gets below the gum. So we don't have to open the gum and cut it. This actually gets below the gum. Here, we are disinfecting the diseased portion of the gum. Those are the bacteria, and we're zapping it with the laser energy.
So this is killing the bacteria as you're doing this?
It is. And if you look over here, there are barnacles of tartar buildup. You heard of tartar buildup?
Yeah.
So we're using this and we're removing the barnacles like under the boat. Mm-hmm. This is the barnacles that form below the gum line. We're removing it. We zap the bacteria, the energy, we're cleaning the barnacles, and what we're doing at this point, we're creating a very healthy environment so the body can heal. Actually, the blood becomes sticky. It's like a glue. It helps to reattach the gum back to the tooth, back to the root of the tooth, and now there's a clean environment. The bone is stimulated to be healthy again and come back and grow.
So that's pretty much how it works.
Yes, this is how it works. Bacteria cause gases. The gases inside the mouth underneath the gum causes the bad breath or halitosis. But we actually do away with the bad breath. You can go out and socialize.
How soon does the bad breath go away?
Immediately, almost within hours.
Because those like gases, or I'm sorry, the infection is gone, so you don't smell like a sulfur kind of a smell?
Bacteria causes the infection.
Okay.
Bacteria also produces gases deep into the pocket.
Okay.
Those gases that come up and stays in your mouth causes the bad breath. So what happens, I have these patients coming and they say, I have bad breath. I use mint, I use gargle, I use Listerine, but I still have bad breath. But see, the bacteria deep into the pocket, they don't have to go and buy gums and mint, try to get rid of the bad breath. Well, the second thing they're going to notice right away is actually the bone acts like a cement that holds the tooth in place. So the bone is healthy, the gum reattaches back, and there's little ligaments around the tooth that hold the tooth to the bone are healthy again. They start to grow again.
So loose teeth, it stops, the loose teeth.
Yes, it does take time to stop, but it will stop. It helps definitely with the loose teeth.
So the part I'm not quite getting is, if you had loose teeth going into this, now you don't have loose teeth, how's that accomplished?
Well, patients come in with space in the teeth, or they have splayed teeth that flare out. It's because the foundation, the bone, is going away. It's resorbs.
From
it's
what?
melting away from the bacteria.
It's kind of eating the bone.
Eating the bone, yes.
Okay.
And what we do is, by doing away, killing the bacteria that caused the problem, the bone has a chance to heal and hold the tooth tight into its place. So the spaces can be stopped, and we can create a healthy environment around the tooth and the root.
Now, we talked earlier that like 30 million Americans have an upper lower denture.
Yes.
And most of them is because of gum disease. In your opinion, I know this is just an estimate, how many of those denture wearers, if you could have got them early with this laser technology, you could have eliminated them losing all their teeth?
Well, all of them, 100%, if I got them in time. The time is the essence here.
Okay.
If the disease progressed for a year, 10 years, 20 years, you have more problem. Well, we still can save these teeth at any time we get them if they're not over the edge. If the problem is over the edge, then we have to yank it and do dentures. But the essence is time.
Okay. Now you do dental implants
Yes.
at your center.
Yes.
You say that you've had you told me in the green room that you've had patients that were told elsewhere that they needed to have all their teeth extracted and get a full mouth of implants or dentures as an option, and you were able to save their teeth many times with the laser.
Yes. Yes.
Really?
Absolutely, yes. With Lenap, with this Perilace, what we do is patients even told that they have to get their teeth out. Well, I had actually Randy came in. His name is Randolph. Randy came in, and he thought he had to get all his teeth out because they were hopeless. He had all these barnacles formed around his teeth. He had bad breath. He had bleeding gums. And in his mind and thought, in his heart, he thought he has to get dentures. But he came and I gave him an option. And I did the whole mouth. Lenap is the whole mouth. I cleaned the whole teeth.
You lasered the whole mouth.
The whole mouth. Saved, got rid of all the barnacles, and as much as we could see. And we got underneath the gum, cleaned it up, and we zap it with a laser. And he came back a month later. His gum's like coral pink.
Okay.
That's what it is, coral pink.
Okay.
That's what I love.
So you didn't have to extract his teeth?
No.
So he was told at another dentist you need all your teeth out.
And get dentures. An implant.
Okay.
But I saved it. I give him an option. We're going to hang on. Now, he's going to be in our practice, and we have a good relationship with him now. He's going to come back every few months. We're going to keep an eye on it and be able to save his teeth for another 10, 20, all his life, hopefully. He's in his 60s, by the way, yeah.
You know, I've had periodontists on this show. Dr. Steve Brown is one of them. He says, Randy, that when a general dentist sends me a patient for a bunch of extractions, what he said, what he used to have to extract, that means remove the tooth, with the laser now, less extractions.
Less
he's
extractions.
saving teeth that he would have pulled just 5 years ago.
Yes, yes.
And that's happening with you too.
There's a shift in my mind
Okay.
since I purchased this laser and invested in it. And now I know I can save teeth that before the laser I would have. You know, if you see if you have a hammer and all you see is a nail, you just want to use the hammer. So this is a different scenario. We can save teeth and be able to give him more options to save more teeth that previously we weren't able to do it.
So is gum disease even a big problem, like in Arizona? It's not something I hear about, but I mean, is it a big problem?
It is a big problem. We can fill out the whole Cardinal Stadium with patients who have gum disease and then some.
Is that
It's
right?
amazing. I mean, that how many people have gum disease. You would never know it, but I've been in practice for 25 years that I know there are a lot of patients who can get help. With the gum disease, keeps the periodontist really busy. I mean, we have 1,000 a week patients.
At least.
At least who get traditional opening of the gum and get the cleaning done. I mean, of the bone surgery to get rid of the bacteria. But you really can't get rid of the bacteria because the bacteria stays there unless you zap it and kill it. With traditional surgery, you're not killing the bacteria. This is killing the bacteria. You still leave a lot of bacteria in there. Yes, you clean it and you get rid of the necrotic dead tissue, but still, bacteria is still there. You're not.
Okay.
You can't get rid of it.
So, because you do cosmetic dentistry, orthodontics, dental implants, because I guess the whole point of this whole thing is getting your gums healthy so you can have a good smile again and be able to eat and chew. So I'm going to ask you, because you're a dentist, of course you think the smile is important. How important is the smile?
Well, the smile is it's more important than frowning. I mean, nobody wants to frown. People want to smile, be able to, I mean, smile. We heard that, you know, eyes are the getaway to the soul. I believe the smiles are the getaway to the soul and the heart. When you smile, people open up to you. They're nicer. They're not judging you as much. Well, I mean, you know, if you have a beautiful smile, we're in business to create beautiful teeth and smile. Let me give you an example. 2 twin sisters for job interview. One is actually smiling. They both have gaps, maybe spaces in their teeth, but one is confident and smiling and energetic and exude energy. Which one are you going to hire? The one who's not smiling or the one who's confident and smiling?
That's a good point. I mean, you're not necessarily going to hire the one with a prettier smile, but if one is not smiling and one is, you hire the one that is.
Because smile exudes confidence, yes. Well, right, this is a perfect example. Look at this guy. I mean, he came to our practice. Take a look at it. He's not smiling, not even looking at the camera. Take a look inside his mouth.
Oh, boy.
Look at how his teeth are. Now, this is too late. We didn't get him soon enough to save the upper and lower teeth. So we did some other options. We give him a beautiful smile. But look at him now.
It does look different.
Doesn't he look confident? Won't you say he's handsome?
He's definitely more handsome than he was before.
Well, that's what I want for our patients. We're not transactional, we're relational.
Okay, good. How old can you be to get this done? Like, let's say you have bleeding gums, bad breath, loose teeth. Could you be in your 70s?
Oh, absolutely.
I mean, there's no age?
No, we treated 80, even 90. 90, as long as
With
you're
the laser,
alive.
okay.
With the laser, yes. If you have gum infection, you're in your 90s, you still can come. At any age, we can zap those bacteria.
Now, I'm not an expert. Could an expert sit here and say, that laser doesn't work? The only way to get rid of this bacterial infection is with surgery, traditional surgery.
Well, I'm sure you can find someone who's going to oppose to laser, but they haven't seen the laser. This laser, Periolase, that does LANAP for the whole mouth, is FDA cleared on specific protocol to do LANAP. If you've gone through, there are research papers. This based on research papers. I mean, if you go and read the training I'm going through, or what I know, you can't really. And if you've done it, you can't oppose to what the result's going to be. You can't. I want to show you this. Another patient came in. Again, if you look at her, she. I took this first photo within moments she walked into my practice and came to the chair. I mean, she looks angry. She looks unhappy. She looks like she can't trust dentists. She doesn't know anything about us, and she just walked in. But look at inside her mouth. This is the patient that I'm going to use laser on the lower one. I'm going to use the LANAP on her and save some of the teeth. We're also going to do some combinations of implants for her. But if you look what we did immediately for her, look at this smile. This is
Very
a
nice.
week. That's 1 week later, Randy. That 1 week. She's smiling. She looks like she's happy. She wrote a nice review for us. I mean, this is 1 week. And we have a relationship to move forward with her and do more changes. This is what dentistry can do. This is what a knowledgeable dentist can provide for his or her patients. It's amazing. It's 1 week later, she's happy. His smile, it's just beautiful. And we're just beginning. That's just the beginning now.
So we're short on time.
Randy, can I just show you one more photo about this patient? I'm really excited about this guy. This guy came to me, and again, look at his teeth. They're so small, and we used laser to kill some of those bacteria. He had a bleeding gum, and he thought that he's going to lose all his teeth. We used the laser to get rid of the bleeding gum, and then we saved his teeth with a beautiful smile. Look at the before. Now he can smile. Actually, look at his mustache. He shaved it. He trimmed it more because he wants to smile more.
So now you told me in the green room, you said if this person probably would have gone to most places, they would have extracted all of his teeth and offered him dental implants. Is that true?
It could have been possible, depending on the knowledge of a dentist. I think some dentists would have said, let me get everything out. He's already missing one tooth on the upper left, but his teeth are so small. But I knew that I can save his teeth. I knew that I could do that.
You go around the mouth with a laser.
Yes.
Kill the infection.
Yes.
Teeth get stronger, and then you obviously did some veneers or something.
And we give him a beautiful smile.
Okay.
Yeah.
We are out of time. And look, you came from Arizona knowing you were going to be on this show. What haven't we talked about, or what's your main message that you maybe haven't even said today?
The main message is there's hope. Get second opinion. If you have bleeding gums, if you have bad breath, if you've been told by a dentist you got to get rid of all your teeth, there is hope. There's other options available. Just get a second opinion.
Okay.
Because I'm using the Periolase by Millennium Technologies, which is actually here in Cerrito, California. A dentist actually invented that and came up with the new technology. There is hope. Just get a second opinion. If you don't want to go through traditional surgery and get the gums open and have stitches, there might be hope. Just take the first step.
So if somebody's watching and they're scheduled for a periodontal surgery, where they cut open the gums and access the tooth root and clean it, get a second opinion with you. Chances are you could take care of it with just the laser.
There's chances that I can take care of it with the LANAP.
Okay. If somebody in your family had gum disease, you would never do the traditional surgery?
Oh, I wouldn't do it. No. If my wife had any bleeding gums, or God, forbid, if my kids ever have periodontal disease or anything, don't want them to go through it. So I want to do the same thing that I would want for my own family.
We have about a minute and a half left, but I know you're also big on this treatment you do for gum recession, also without traditional surgery. Tell me about that.
With dentistry or surgery, all across the U.S. or in the world, traditionally you take a patch of the gum from the roof, and then you place it on that area and you stitch it. You have to put the stitch.
For the gum recession.
For the gum recession, but it's painful. Well, what we figured out, we always knew that we can bring the gum down, but it wouldn't stay. It would shrink back. But we figured out a way that using collagen through the pinhole, it keeps the gum at the lower level, and the recession can go away. I mean, this
cold
is amazing.
sensitivity is gone?
Yes, if people have cold sensitivity, if you have a beer, if you want to drink a beer, or you're skiing up in the mountain and you feel all of that cold in there in your teeth, now with the pinhole surgery, now you can have a beer in front of a beach, or you're up in the mountain and you feel like your teeth are really cold, or, and then all that air gets in there. Now we cover the exposed roots with the pinhole.
So what's causing the cold sensitivity is the root is exposed because of the recession.
Yes.
So you pull down this, it stays down. How soon could the cold sensitivity go away? And could they eliminate these toothpaste for sensitivity?
Well, absolutely. You can eliminate the toothpaste if the recession is completely covered. Some cases it's 80%. If you have 10 teeth, 80% of it is successful. 80 out of 10. So 8 out of 10 teeth that have recessions will be successful.
You could always do it a second time, though.
And there's always we can do a revision on it and bring it down furthermore. If the first time doesn't work out, we can do it again.
All right, so today's topic, no more bleeding gums, bad breath, loose teeth, and now no more gum recession.
No more gum recessions.
But your challenge, because we've talked about this, look, especially men, we put it off. We only go to the dentist, you said, when we're in pain.
That's why we have spouses, to make sure we go.
Do the spouses ever drag the
husband
in?
Yes. Yeah, it happened a week ago, actually.
Okay.
One of the ladies brought her husband, and it's time to go see a dentist. But thank God for our spouses.
So it's always cheaper, obviously a lot less expensive to get it done. So if you're flossing and you're getting blood, that's like a slam dunk easy with the laser to stop that.
Yes.
Like if you get them in early.
Yes. The key is time, early.
Okay, good. Final message. Somebody watching this, we're out of time. They have the bleeding gums, bad breath, loose teeth, but the last thing they want to do is go to a dentist. And maybe they've heard what you have to say, but they're skeptical. What do you say to them?
I just come and see us and let's talk about it. Let's meet face to face and talk to you. What we can do and what it's all about possibilities.
Okay.
Possibilities. It's all about possibilities. It doesn't hurt to talk to someone that you feel comfortable and talk to.
Okay, good. Thanks for coming to the show.
No, thank you very much for having me.
Thanks. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.